কি আমার স্লাইড আসবে ফরওয়ার্ড করলে কি স্লাইড আসবে
না
Today, one of the distinguished speaker, Professor Dr. Rowshan Morshed, gynecologist and obstetrics specialist, and she is also the president of OGSB Chittagong Chapter. She was former professor in the Chittagong Medical College and Hospital, Bangladesh. And here, before introducing you to the speaker formally, let me share my personal experience with her. When with our Pro-Chancellor, Professor Banerjee, we had been to Dhaka and then to Chittagong. We are very fortunate to enjoy the hospitality of Professor Dr. Rowshan Morshed's friend, the first woman Vice Chancellor of Chittagong University, Professor Dr. Sheikh After. And we are really overwhelmed with her kind hospitality. And during the International Women's Day, the lecture that I have heard being delivered by Professor Dr. Rowshan Morshed about women's health in just Bengali was so mesmerizing that I predicted that if someday Bangladesh will get a Nobel Prize, that will be due to their higher education being studied in their native language. So I also welcome Madam Grace Ekelo. Grace Ekelo, the former ambassador of Uganda to India. Madam, kindly accept my salutation. And we have amongst us our Honorable Vice Chancellor, Professor Ashok Mahapatra, the renowned neurosurgeon. And we have also got our Pro-Chancellor, Professor Amit Banerjee in the audience. And as all of you know, he was our Vice Chancellor for 5 years in this university, a renowned cardiac surgeon. So now it's my privilege to introduce the speaker for the benefit of our audience. Professor Dr. Rowshan Morshed was born in a small village called Akabar Deil of Kutubdia Island located at Coxs Bazar, Bangladesh on 3rd June 1957. Just 8 days back, she must have celebrated her birthday. Her father, Sheikh Makbul Ahmad Sikdar, was a businessman and mother Farida Khanum was a housewife. After completing her primary education from Ali Akbar Deil Government Primary School, Professor Rowshan successfully passed her SSC from Coxs Bazar Government Girls High School in 1973 and HSC in 1975 from Chittagong Government Women's College. After that, she passed her MBBS degree from Chittagong Medical College in 1982. After a year of foundation training, she started her professional life from the rural village of Bangladesh. At her very important phase of early professional career, she served 3 rural upzillas of Chittagong, including Rangunia, Boilkhali, Dohazari, as a medical officer and served the women of that areas. In 1997, Professor Rowshan passed her DZO from the University of Dhaka, and in 1999, she did her FCPS and joined Chittagong Medical College Hospital as a resident surgeon. After years of serving in different post positions at CMCH, she got her retirement as a professor of gynecology and obstetrics in 2016. Always being very concerned and cautious, she did a lot for the development of women's health, holding important positions in different times. She served as General Secretary of Chittagong OGSB twice, as a Vice President of Central OGSB and President of Chittagong Chapter OGSB very successfully in recent times. During her time as Vice President of OGSB Chittagong, she worked in almost every Upzilla of Chittagong for women health development, worked for the healthcare of the garments workers, initiated school healthcare programs, conducted health camps in the slum areas of Chittagong city. As an academician, for the easy understanding of the students, she has initiated to write a book named Clinical Guide to Obstetrics and Gynaecology. The book has earned popularity among the students, not only inside the country, but also countries like India, as a very useful guide to solve the clinical problems easily. Currently, Professor Rowshan is practicing as a consultant in CSCR Chittagong and is also involved in many social activities. Many of our research papers have been published in different scientific journals.
Good afternoon, Madam Rowshan Morshed. She is now in Chittagong. Welcome her that she will be delivering a lecture on adolescent health problem. I, being a doctor, I am a neurologist at AIMS Delhi, New Delhi, as a neurosurgeon and retired as a Dean of All India Institute of Medical Sciences, New Delhi. Currently, I am Vice Chancellor. Regarding our university, this university started 2007, but the trust, Siksha Anusandhan Trust, started in 1995, and the engineering college started in 1996. Thereafter, we had management, nursing, dental college, dental sciences, and medical science, biotechnology and pharmaceutical science, agricultural science, law, in part of the law institute. Then we are adding veterinary. So we are currently having 15,000 students, and there are 10 institutes with a teacher-student ratio 1:9. We have about 1,500 teachers to 15,000 students or so. Our female student ratio is, female student is 47% and female faculty are 37%. So we have no gender bias so far as the male and female students and faculty are concerned. Currently, we rank in India by national ranking framework by Government of India Education, 21 university, and our medical science is ranking at 21, and engineering science at 32, and our dental college is 14. This year we will be part of Eastern India, and how to have an inclusive, our education should be inclusive with the society. We give a lot of stress to human values, our Indian knowledge system, and we also social activities like National Service Scheme. Dr. Sharma is the director there. We give a lot of regards to. We have adopted several villages. We have about 1,500 beds, a hospital under which is a medical school with 250 intake medical students, 100 postgraduate students per year, and we have started super specialization, neurosurgery, cardiac surgery, oncosurgery, GI surgery, about 10 to 12 super specialty we have started super specialization. We do some liver transplant, bone marrow transplant, and kidney transplant. So, and our hospital being a university hospital is very cheap as compared to other corporate hospital in Bhubaneswar. So I, being a doctor, I know what are the adolescent problem. The adolescent problem is not only related to the adolescent girls, it's also adolescent mad boys. Every day, I am a pediatric neurosurgeon practicing pediatric neurosurgery for the last 35 years to 40 years. So I see how the people have become young boys after their 6th or 7th standard, usually between 12 and 17, 18, before they come to medical engineering, how they behave. There is a hormonal imbalance, there is attitudinal difference, and there is also socio-cultural changes in the body. So it is not only the adolescent health for the girls, there are also adolescent health for the boys. They become very angry. Every time I see a boy, he shouts at the children when they are at 8, 9, 10 standard. And more importantly, during this pandemic, they have become much more worse because they are sitting at home doing nothing. And at best, they have few lectures online. So none of them speak, or most of them don't speak, sleep before 2 a.m. When I was director of AIMS Bhubaneswar, that is between 2012 and 2016, we studied 560 medical and nursing students. I started the medical student nursing college and a technology college and postgraduate school. And we studied 560 students. Most of the students don't sleep before 2 a.m. They do not brush and take breakfast. They come morning 8 o'clock. They don't take bath. And many of them are overweight. They keep on eating throughout night up to 2 a.m. and keep on chatting or look at the Facebook. So the entire lifestyle of the youth has become bad. That is how nowadays we find people at 30 and 35 having heart attacks, brain hemorrhage, they are overweight, they are depressed. Even they go to the best medical or engineering school, they commit suicide. So their mental state, physical health, and spiritual aspect of life is totally ruined. So when you are going to talk about female or girls, adolescent problem related to gynecological problem, there are a lot of problems otherwise in adolescent boys for which either we have to take clinical psychologist or to the clinician depending on what type of manifestation they have during that semi-madness or change of body hormone and their attitudinal and social cultural changes. So I think it's a very important part of the human life when one phase of the life gone, childhood, and another phase, youth, has not come. This transitional period is very, very important for boys and girls, and the adjustment is very difficult. So I think Dr. Sharma has got Dr. Roshnam. She was a very senior. What I heard from Dr. Sharma, she did MBBS in 1975. So she's almost from my batch. I did MBBS in 74, and I think we are going to hear how she is managing the girls' adolescent problem, not only in Bangladesh, which is appropriate all over the girls in the world. I think it is an age-related problem, that regional problem. So I think it will be a wonderful topic to discuss, and I'm sure our teachers and students will get benefit out of that. Thank you, madam. I'm very happy that I was last week in Dhaka for the International Conference on Neurosurgery, and I delivered 8 lectures. Thank you for your presence to deliver a lecture on a very important topic of the youth. Thank you.
Thank you, sir. Thank you. Now I'll request today's speaker to kindly deliver her talk. Madam.
First of all, I would like to express my heartfelt thanks to Dr. Sharma for his kind words about me. And I also very much thankful to Professor A.K. Mohapatra, Vice Chancellor, Siksha o Anusandhan University, for his brief description about his institution. Honorable VC, Siksha o Anusandhan University, Professor A.K. Mohapatra, Pro VC, Professor Amit Banerjee, faculties, dear students, very good evening to you all. I am Professor Rowshan Morshed, retired Professor of Obs Gynae, Chittagong Medical College, Bangladesh. I was immediate past president of our Society of Chittagong branch. Chittagong is the second largest city and the main port city of Bangladesh. This hilly city, with its panoramic beauty, situated at the bank of River Karnofuli and Bay of Bengal. Dear audience, I feel very much honored to have an invitation from this prestigious authority to be a speaker of today's august gathering. Professor A.K. Mohapatra told that not only the adolescent girls, the problems of adolescent boys should be also focused. As I am a gynecologist, I have chosen my subject on adolescent gynecological problems for my today's presentation. Yes, adolescents have many problems like sexual, mental, emotional, social, educational, as well as gynecological disorders. But among these, the gynecological disorders, if not identified and treated properly, it may affect the adolescent girls' health very badly in future. Dear participants,
Madam, please tell your person who is doing the presentation to make it full screen.
okay. It's all right?
No, it is still not coming full screen. So that the side, the thumb panels will go and only the slide will be visible.
Okay, I'm trying.
You just try for 1 or 2 minutes, otherwise you can do with this.
It is now full screen.
No, you please click on this icon, this flash shaped icon. Here,
Now we are,
you just put it. Share the screen once again.
we are facing some trouble to full screen.
Okay, we'll do with this. Okay, please continue.
Dear friends, all of we know that adolescent women's life starts at birth and ends at death. Adolescent is the period when a carefree child becomes a responsible adult. The age ranges from 10 to 19. Again, the adolescent period is divided into 3 phases. The teen adolescence, which extends from 10 to 13 years. During this phase, the growth spurt as well as the secondary sex character develops. the mid-adolescent, which extends from 14 to 16 years, and the late adolescent, which extends from 17 to 19 years. During this mid and late adolescent period, they feel attraction to opposite sex. They want to communicate with their peer groups, and they try to maintain a separate identity from their parents. Today, I will try to focus on the adolescent gynecological problems, but I don't know how much is possible to discuss the whole subject in this limited time period. Dear friends, among the gynecological disorders, menstrual abnormalities are very common in adolescent girls. But before going to the menstrual abnormalities, I shall try to focus on normal menstruation. All of we know that the menstruation is regulated by two systems. One is the central system, comprises the hypothalamus and pituitary. The peripheral system comprises the uterus, cervix, and vagina. The ovary lies in between two systems and acts as an ambassador. Now, let us see what is the normal menstruation. The average age of menarche is 12.8 years. The interval between two cycles is 21 to 45 days, average 32.2 days. The bleeding period lasts for 2 to 7 days, and the blood loss per period is 30 to 40 ml per day, up to 80 ml. So, let us see what are the menstrual disturbances occurred in an adolescent girl. They are in the form of amenorrhea, dysmenorrhea, and abnormal uterine. Primary amenorrhea is the absence of menstruation beyond the age of 16 with presence of secondary sex character, or absence of menstruation beyond the age of 14 in absence of secondary sex character development. Now, what are the causes of primary amenorrhea? Primary amenorrhea usually caused by anatomical abnormalities in the lower, that is the peripheral system, that is the absence of the uterus, congenital atresia of the cervix, transverse vaginal septum, and the commonest one is the imperforate hymen. Besides this, there may be dysfunction of the regulatory system. What is the impact of primary amenorrhea on health? If the causes of primary amenorrhea is not treated properly, as for example, if imperforate hymen is not drained timely, there is accumulation of menstrual blood in the uterus and as well as in the vagina, and there is retrograde flow of the menstrual blood into the pelvic cavity, which later causes pelvic endometriosis. Again, if there is the absence of the ovary And if it is not treated by hormone replacement therapy, the girl will suffer from the deprivation of the estrogen throughout her life. And there is every complication of estrogen deficiency will develop. So there are many diseases of the central nervous system which should be evaluated and treated properly for the good health of the adolescent girl. Now, secondary amenorrhea. Secondary amenorrhea is one where there was menstruation earlier, but the girl does not have menstruation for 6 or more consecutive months. Secondary amenorrhea may be due to physiological causes or may be due to pathological causes. Among the physiological causes, the pregnancy and lactation is very common. Among the pathological causes, polycystic ovary syndrome, other endocrine pathologies like thyroid disorder, diabetes mellitus, etc. are related with secondary amenorrhea. What is the impact on health? Secondary amenorrhea may also result from dysregulation of the regulatory system. If there is any problem in the central or peripheral regulatory system, there may result secondary amenorrhea. And secondary amenorrhea, if not treated properly, it will impact the health and well-being of the girl. If she does not know and she does not have adequate knowledge on sexuality, she may become pregnant, and it is usually an unwanted pregnancy, and the girl tried to terminate it by induced abortion. So there is complications of abortion will be there. Besides this, if secondary amenorrhea, there is menstruation following the amenorrhea, there will be prolonged bleeding. Sometimes it may be due to the unopposed estrogen stimulation of the endometrium, so it may lead into anemia. So one should attend the doctor if she develops secondary amenorrhea. Now I will tell you about the disturbance of cycle. That is, the cycle may be too frequent or infrequent, but there is nothing to worry, because within 2 to 3 years of menarche, there is immaturity of the central controlling system, and so the ovary cannot get proper signal from them. So there may be frequent or infrequent menstruation. Usually it does not need any treatment. Counseling of girl as well as the parents is enough to make the condition tolerable. What is important is the menstrual period. That is how long the menstrual period extends and what amount of blood the girl usually loses in her period. The heavy menstrual bleeding is a condition where there is excess bleeding during menstruation, which affects the general health of the girl, or when a sanitary pad is completely soaked within less than 2 hours, or a girl needs to use more than 6 pads per day. What are the causes of heavy menstrual bleeding? Ovulatory dysfunction, usually PCOS, is the commonest cause, and coagulatory dysfunction. Then what to do? First of all, we have to confirm the diagnosis and exclude the coagulation disorder. If there is no coagulation disorder, the heavy menstrual bleeding in adolescents may be treated by progesterone alone, cyclical progesterone in the form of norethistérone 5 mg TDS starting from 5th day of the menstrual cycle for 21 days for 3 to 6 cycles, or combined oral pill for 3 to 6 cycles. But when there is coagulation disorder, one should consult a hematologist. Another common menstrual disorder is dysmenorrhea, means painful menstruation. There is some source of discomfort or lower abdominal pain during menstruation, which is very usual. But when the pain is of such magnitude that it interferes the day-to-day activity of the girl, then it is called dysmenorrhea. Dysmenorrhea is of 2 types, primary dysmenorrhea and secondary dysmenorrhea. So friends, let us see what are the criteria of primary dysmenorrhea. It is usually due to endometrial prostaglandin imbalance. Friends, we know during menstruation there is secretion of prostaglandin F2 alpha from endometrial cells, and this prostaglandin causes strong contraction of the myometrium, and during this contraction there is ischemia of the myometrium and the girl experiences severe pain. It usually starts prior to menstruation and lasts for 2 to 3 days following menstruation. It is colicky in nature, radiates towards back and thigh, and usually associated with nausea, vomiting, and diarrhea. Counseling of the girl as well as her mother is very important, and it can be treated by antispasmodic, NSAIDs, and oral contraceptive pill. What are the impacts of this dysmenorrhea? It may result in school absenteeism, inability to participate in sports, inability to do household activities, and not reporting to office. Now, secondary dysmenorrhea. This condition is always secondary to some pelvic pathology. The common cause of secondary dysmenorrhea in adolescents are pelvic infections and pelvic endometriosis. So, what are the criteria of secondary dysmenorrhea? It usually starts 2 to 3 days prior to menstruation, relieves when menstrual bleeding starts, It is dull, aching nature with no radiation to thigh and back, not associated with nausea, vomiting, and diarrhea. There is associated pelvic congestion. The treatment is to treat the cause. Another common abnormalities which is seen in adolescent girls is polycystic ovary syndrome. The incidence is 3.7 to 22.5%, average is 10%. Now let us see what are the diagnostic criteria of this syndrome. There is oligomenorrhea or amenorrhea. Second, there is signs of hyperandrogenism in the form of hirsutism. And third criteria is the ultrasonographic findings of enlarged ovaries with teeny multiple cysts arranged at the periphery of the ovary. If among these three findings, if two findings are positive, then it makes the diagnosis of polycystic ovary. It is the Rotterdam criteria to define polycystic ovary. Now, let us see what is the etiology of polycystic ovary syndrome. The etiology is not so clear. It may be due to environmental factors, genetic factors, or due to lifestyle. So, what are the hormonal changes occurred in PCOS? There is high level of LH, insulin resistance, and there is depression of the hepatic sex hormone binding globulin synthesis, and so there is increased free androgen estrogen. Please let us see what the high level of LH is doing. When there is excess LH in secretion, it stimulates the thicker internal cells of the ovary, so there is increased formation of androgen. This androgen is converted into estrogen in the peripheral adipose tissues by the enzyme aromatase. So there is formation of estrogen, mainly the estrone. This estrogen has again positive feedback to LH secretion. So there is more androgen formation, and estrogen has negative feedback on the follicle stimulating hormone. So there is no maturation of the follicle. The follicles become atretic. So there is an ovulation, and when there is an ovulation, there is no pregnancy or corpus luteum formation. When there is no corpus luteum formation, what will occur? There will be no progesterone. So let us see what is happening. There is excess estrogen in the circulation. There is excess androgen in the circulation. This estrogen, not opposed by progesterone, acts on the endometrium, causes endometrial hyperplasia, and the androgen will cause the signs of hyperandrogenism in the form of hirsutism, which means unwanted hair in the face, upper lips, in the chest, and in the lower limbs, lower abdomen of an adolescent girl. So, the high level of LH is responsible for all these changes. The second hormonal change is insulin resistance. So, what is happening? There is increased insulin in the circulation. This insulin acts on the insulin-like growth factor in the thicker internal cells of the ovary. So again, there is formation of androgen as well as estrogen. The insulin and the androgen, I have told earlier, that suppresses hepatic sex hormone binding globulin secretion. So there is increased free androgen and estrogen, which are biologically active. So, why it is important to know about PCOS? Because it is related with infertility. It causes heavy menstrual bleeding, leads to anemia. It may cause metabolic syndrome, that is diabetes, hypertension, dyslipidemia. It also causes obesity and its related complication. And I have already told that the unopposed estrogen stimulation causes endometrial hyperplasia and ultimately endometrial cancer. So, what should be the treatment? First of all, lifestyle modification is very, very important to reduce the weight. What we mean by lifestyle modification? Lifestyle modification is to change our food habit. We should avoid the fast foods, the ice creams, the cold drinks, beef, mutton, etc. The girls should have exercise in the form of swimming, in the form of walking, or weight-bearing exercise. And the second important thing is to prescribe metformin because it reduces insulin resistance. So the insulin can work properly and there will be less formation of androgen as well as estrogen. When there is less estrogen, it will give positive feedback to hypothalamus and pituitary for secretion of the FSH. So when there is FSH secretion, there will be maturity of the primordial follicles to Graafian follicles, and there will be ovulation and there will be menstruation. So it is very important to reduce the insulin resistance by metformin. The third important one to make the cycle regular is the progesterone, cyclical progesterone alone or combined contraceptive pill in combination with estrogen. This is a picture of Harnam Kaur, an adolescent girl. She had hirsutism and she needed to remove it 2 to 3 times in a week. She became the She used to face the insult and bullying from others. Then one day she decided not to remove her beard, and now she's just looking like the picture. I can say it is one of her revolution towards the society. Then another important subject of adolescent health is vaginal discharge. Many of our girls come to us with their mothers and complaining of vaginal discharge as well as complaining of weakness and backache. And their mothers used to say, her girl is becoming sick and thin from day to day due to this vaginal discharge. But let us see what is the vaginal discharge, what are the functions, and so on. So vaginal discharge is a fluid made by the cervical and vaginal glands. It composed of the vaginal epithelium, this squamate epithelium, as well as the microorganisms of the vagina. The functions of vaginal discharge is to make the vagina clean, moist, lubricated, and to maintain the pH. When we examine a vaginal discharge, how shall we describe it? We will describe the amount, the color, the odor, and texture of the discharge. Now let us see what factors determine the character of vaginal discharge. These are the day of menstruation as well as the pregnancy. During menstruation, there is discharge in the proliferative phase, which is maybe 1 teaspoonful per day. But during the time of ovulation, discharge become 3 times or more than the discharge of proliferative phase. Now, let us see what is the character of normal vaginal discharge. Normal vaginal discharge is clear or milky white and there is no odor. So, and it is not associated with any weakness and backache. When to consult a doctor? When the complaint of the girl is vaginal discharge. One should consult a doctor when there is sudden increase of the discharge, number 1. Number 2, when there is associated foul smelling, when there is associated itching, and when there is pain in the vaginal or vulval area, when there is blisters or sores in the vagina, and when there is intermenstrual bleeding or there is bleeding following coitus. So when there are the complaints of these things, one should consult a doctor. Now, what are the causes of abnormal discharge? The abnormal discharges are due to many organisms. First of all, one is yeast infection in the form of candidiasis or moniliasis. What is the character of this discharge? It is usually thick, white, cheesy clamps with itching. It is not a sexually transmitted infection. The risk factors of moniliasis are pregnancy, use of oral contraceptive pill, and prolonged antibiotics therapy. The treatment is by antifungal agent like nystatin and the econazole or the fluconazole. The second common vaginal discharge, which is yellowish, grayish white with fishy odor, and there is swelling and inflammation and swelling of the infected area. It is due to bacterial vaginosis. In the picture, dear audience, if it is not that big, you may feel difficulty to see it, but it is mentioned in the picture. So bacterial vaginosis, the cause is not known, but it may be due to imbalance of the vaginal epithelials. Number 1. Number 2, dosing. Number 3, new sexual partner. And number 4, multiple sex partner. So it is not a sexually transmitted infection, but it increases the risk of sexually transmitted infection. The third common vaginal discharge is caused by trigeminal vaginalis. The character of the discharge is yellow, green, frothy, foul-smelling, and there is some pain and inflammation in the vagina. It is a sexually transmitted disease, so treatment of both partners by metronidazole is essential. Another type of vaginal discharge caused by gonococcal infection, it is cloudy, yellowish discharge with dysuria. When such discharges are very common in sexually active, so one should consult for this source of complaint. There may be sometimes the brownish or blood-stained discharge, which may be due to hormonal imbalance or due to cervicitis or cervical polyp. Let us see how to maintain the vaginal hygiene to prevent this source of infection. Vaginal hygiene can be maintained by cleaning of the vaginal area once daily by warm, clean water or mild soap water. Clean the vagina from front to back, but not from back to front. Repeated cleaning or dabbing should be avoided. Avoid the use of perfume, deodorant, or spray and feminine washing. One should wear cotton undergarments. Sexually active girls should use barrier contraceptive, and in case of prolonged antibiotics therapy, we should use probiotics. Next, I would like to show you the status of adolescents in Bangladesh. 24.5 million of Bangladeshi population is adolescent. That is 20% of the total population. Adolescent girls comprises 14.4 million. 60% of the girls are married before the age of 18. So, dear friends, the statistics of the India may be same or close to it. So what to do? We don't want adolescent marriage because it is associated not only with the physical complication, but there is also mental depression, social deprivation, and they don't make their motherhood safe due to the negligence of herself not only, but negligence of the family as well as by the society. So we want to lower the percentage of marriage before the age of 18. How could it's possible? It's possible by spread the health education to the grassroots level. But who are the volunteers? The volunteers should be the village leaders, the teachers of primary school, the health workers, as well as the family member, the particular families. In Bangladesh, 33% of adolescent girls become mothers in 15 to 19 years of age. We don't want any adolescent becomes a mother because adolescent pregnancy is associated with so many complications in the form of abortion, high-deform mole, pregnancy-induced hypertension, preterm labor, obstructed labor, and its sequelae. So how can we reduce the number of adolescent mothers? It can be reduced by using the proper use of contraceptive methods. So we should make our adolescent to use contraceptive methods properly, and it should be given from government source, and it is just doing by Bangladesh government in our country. Now, what is the suitable contraceptive for the adolescents? It is combined oral contraceptive pill or the barrier methods. Next, 20% of the adolescents had no antenatal checkup. So, and 38% practices the contraception. So, dear friends, what is the condition of the adolescents in our country? So we don't want these sorts of accidents or the miseries of adolescents in our country. The important thing is that as there is no reproductive health education and sex education in our school curriculum or college curriculum, the adolescent girls, less than 30% of the adolescent girls have knowledge about STD and HIV. So it is the end of my presentation today. Thank you very much. Thank you.
Thank you, madam. Thank you very much. Now we have we have come to the close of the time, but I'll request madam to, if you have got one or two questions, then you can ask. Anybody who can ask a questions to madam? So that will be better. Or I will ask a question. Now, madam, actually we should prevent adolescent marriage like 19. So what is in India, probably the 21 government has fixed the age for marriage of the girls. So, from a medical point of view, what is the best age for marriage so that there will not be any complications, at least the adolescent complications?
In our country, the age of marriage is beyond 18 years. That is, I should say that it should be by the age of 20 or more, because during this time, the pelvic of the female pelvic bones becomes matured and the pelvis get its usual shape. And so if there is pregnancy, the pregnancy complications in the form of obstructed labor are less. Again, in the adolescent age, the complications like abortion, pregnancy-induced hypertension, these are very common. So it should not be an adolescent marriage, but the marriage should be by the age of 20 or more.
Thank you, madam. And another question, because you have that book, Clinical Guide to Obstetrics and Gynaecology. That book
Yes.
is already available in Bangladesh, and is it available? I think it is also available in India, isn't it, madam?
Yes.
So, how many pages the book is? Which Amazon can we get this book in Amazon, or how can one get this book?
I will let you know, Dr. Sharma, how can you get this book.
Yes. So at least
We'll
we
let
can.
you know.
Yes, and why I am telling you, at least because you see, we have got a translation unit in our university, and this is functioning. As you know, Education Policy 2020, government is also giving a lot of emphasis on knowledge in regional languages. So if this book can be translated into Odia, so it can benefit many girls in our state, at least in villages, in cities, and everywhere. So your book and this knowledge should permeate to a large audience. So I think if you can find out, kindly send it me so that we can see how this book will be translated into Odia. For that, actually, we need a obstetrics and gynecology doctor here in our medical college, and also a language expert. So both can do a faithful translation of this book into Odia. Is it also available in Bengali?
No, it's not available in Bengali. Actually, this book is very helpful for undergraduate as well as for postgraduate medical students.
Okay. But it should be translated. You see, because at least I was expecting that this book is available in Bengali. Ultimately, the whole everything should be available in regional language so that it can so larger people can have a reach over it. So
I shall try to give you the information. How can you get this book?
Yes, madam. Yes. So if there is no question, then is there any question? Our people are very shy of asking questions. That is a very because that is due to our educational system. Unfortunately, we have not encouraged students to ask questions. Rather, we are
questions.
Yes, Elena, you can ask. Elena was doing BSc nursing in our university. She has got the state best NSS volunteer award, and she is in the last year of MSc, this masters in public hospitality administrations. So Elena, you can ask your question.
Congratulations, Elena.
Yes, ma'am. Good afternoon, sir, ma'am. I have one question. As you, ma'am, told that yeast infection with like bacterial infections are commonly for our girls, but how can we prevent? Like because fungal infection is repeatedly done. Like if the medication is continue for 1 month, Then if one is discontinue that medication, then again that will happen. So the best method and the best treatment, which one is preferable? Please, can you tell, ma'am?
Actually, for repeated fungal infection,
Yes, ma'am.
one should have oral fluconazole or ketoconazole. So, and the dose is usually for fluconazole 50 milligram daily for 14 days or 150 milligram once weekly for 3 weeks. But if there is repeated fungal infection, one should check the sugar, and if she is on antibiotic therapy or she is on OCP, in antibiotic therapy, she should have probiotics, or in OCP, she has to change another contraceptive method. It is better. And I have told you that one should maintain the vaginal hygiene also.
Hygiene also, yes, ma'am.
The important one is the menstrual hygiene. Still, our girls, they don't know how to
yes, ma'am.
use
Exactly.
the pad, how long she use the pad, and when she change it, and how she clean her private part. They don't know it. And again, many of the girls are using the undergarments which are not made by cotton. So these are very important things. Again, somebody sometimes uses the perfume or deodorant in the private part. So these practices should be avoided.
Yes, ma'am. Thank you, ma'am.
Thank you, Elena.
Thank you.
Thank you. I think for all of you, this lecture must be very beneficial, isn't it,
Yes,
Elena?
sir. Yes, sir. This is very much useful with knowledgeable also, sir.
Because
Actually, we should know all these, and we should create awareness all these among our university with rural area also.
Yes,
because
yes.
this disease is very common in our
Yes,
state
yes.
also.
Yes, yes. That is why I was emphasizing on Madam's books to be translated into the regional language, which we can definitely take. So I think because I am extremely thankful to you, Madam, and on behalf of the University Outreach Cell and the university, we are really grateful and thankful to you. So words cannot express my gratitude, how much you have spent your time. Anyway, the lecture that I have heard in March 8 was still there in my mind, which could drive me that at that very day I promised that I must bring you to a larger audience. And I am extremely thankful and really God's kindness that that has become fruitful, and we have got you. And another still is there. I will request the Honorable Vice Chancellor, Professor Sheikh After, to also speak to our students, because I have also listened to her, how brilliant speaker she is. And it is needless to mention that the fluency with which you have spoken in Bengali, the same structured, simple, and very nicely you have presented your talk in English also. That is why, because you have understood this subject very nicely, that's why language is not a barrier for you. We are extremely thankful and grateful to you. Thank you, Madam. Thank you so much.
Welcome, sir. I am very much overwhelmed to be a speaker of this session.
Thank you. Thank you so much. And we will be looking forward for your physical presence in this university. Thank you so much. Thank you.